What 4 things can you do to reduce pain in labor? Let's look at how you can cope better with contractions and actually have less pain. So let's look at this fear, tension, pain cycle. This was actually identified way back in the 1950s by Dr. Grantley Dick Reed. He noticed that some of his patients had a lot of pain in childbirth and some of his patients did not. They coped very well. So he really researched what the differences in how they were dealing with their labor. And what he found is that women that were unprepared, that didn't know what to expect in labor and birth, had a lot of fear. That fear caused them to feel a lot of tension and stress in labor, and they had so much stress and tension that it actually increased the pain of childbirth. So to break that cycle, what we know now and what he learned is that if we become more educated about childbirth, about what to expect and also what our options are these days with choices and interventions, that's going to decrease our fear. Also, if we can learn how to use relaxation techniques and other comfort measures to work with our body, that will actually decrease our tension. That can also decrease our pain because the more relaxed we are, the more we work with our bodies, that's going to increase blood flow to the uterus. That's going to actually let the uterus do its job better, so your labor progresses better, but you have less pain. Also, that increased blood supply will benefit your baby because that increases the oxygenation status of the fetus. Did you know there's some awesome advantages to being upright in labor? Walking and standing in labor really allows a lot of great things to happen with labor progress. So when you're in an upright position, it actually causes the contractions to be stronger, but you feel less pain. So it's a great combination. Also, in the research, those women that are more upright do have shorter labors and better labor progress. Hi, I'm Susan White, certified nurse midwife with Childbirth Education for the Christian Family, and I want you to be informed so you can feel empowered in birth. Let's talk about the advantages of having a well-prepared labor support person with you. So in the research, women that have that one-on-one support from a labor support person had lots of advantages. They needed less pain medication, they had shorter labors, they had less risk of needing vacuum or forceps delivery. And that could be because with that one-on-one support, they had less stress and tension and anxiety. And as we mentioned earlier, that's going to help the contractions work better because of the increased blood flow to the uterus. Now, if that labor support person, whether it was family member or friend, if they also attended classes to learn how to give that labor support and how to learn how to take care of that mom in labor, then what they found was there even more benefits, including those babies had a higher APGAR score after birth. And the APGAR score is just a way of looking at how that baby's adjusting to life outside the uterus. Then they've also found in other research there was actually a decreased risk of having a C-section if you have a well-prepared labor support person with you.